She might let us just go.
Somebody's got to work on me. Come on. Got a headache here. Hips, thighs. Hips, thighs. This is the lecture part of massage therapy techniques for your hip and thigh. This is the fun part. You guys have been doing all those lectures, and this is the fun lecture. Learning objectives, you can do that yourself, but it's just on the slide. Identify muscles. Understand origins. Movements. Right. Apply knowledge. Right. So, overview of the hip joint. The hip joint is a ball and socket synovial joint. It consists of the head of the femur and the acetabulum. Acetabulum. That is the actual socket for your ball. Bless you. Remember your hips. A lot of this is review, guys, sort of. Your hips can flex, extend, adduct, abduct, rotate, and circumduct. Now we also have some ligaments that are stabilizing ligaments. So you have your iliofemoral ligament, which is the strongest. It is actually right in here, this picture here. Just think femoral, the femur. Ilium, right? So it's kind of up here. And it just connects those two so they don't just pop out of socket, right? Then you have your pubofemoral. Can you guess where that's at? The pubic region, right? And the femur. And the ischiofemoral. Can we guess where that is? Yeah! I just screamed into the mic. Sorry. So your major hip muscles, your flexors would include, I'll get that later. Your flexors for your hip would include everything in the front, right? Iliopsoas, your sartorius, your rectus femoris. Your extensors are going to be your hamstring group, your gluteus maximus. Then you have abductors, right? Your gluteus minimus is going to abduct, and your TFL. You have your adductors. Your adductor magnus, longus, brevis, right? So those are inner thigh muscles, gracilis and pectineus. Last but not least, we have our rotators. Your piriformis, you have those obturators, internus, externus, gemelli, and your quadratus femoris. Hamstring group. Remember, ham has 3 letters, H-A-M. So you have your bicep femoris, your semitendinosus, and your semimembranosus. Again, it shows your origins. Ischial tuberosity runs down. Depending on which muscle, it's either going to connect onto the tib or the fib, right? Your hamstrings primarily will extend the hip and flex the knee. Yes. Common issues with this group. If there is tightness, generally there is low back pain. So remember, man, I need to get my number off these lists. The amount of spam calls I get is, the government's closed, so you can't add your number to the do not call list for the spammers yet. All right, quadriceps, front thigh. Quad, 4. There's 4 muscles. Rectus femoris, vastus lateralis, vastus medialis, vastus intermedius. All the vastuses with the names telling you what part of the thigh they're on. That's a given. Origin. The femur, AIIS for the rectus femoris. They're going to run down, remember all those join together as a family and say, hello, tibial tuberosity. May I connect here? And they say, yes. Wake up. Actions of the quadricep group. Knee extension, kicking somebody. Hip flexion for the rectus, because that is the one that crosses over the hip, right? So if there is an imbalance in your quad muscles, it can affect your gait and your posture. That is either hyper or hypotonic. Either way, you can have an imbalance in how you walk. And if that happens, you have an imbalance throughout the body, right? Gluteal muscles. We learned this. You got your glute max. Now your gluteus maximus is your main hip extensor. It is a large muscle, and it's doing a lot of the work. Your glute med and min are abductors. They also can help stabilize the pelvis, right? Then you have your good little piriformis muscle. So it's not showing in the top picture, but this bottom picture here, I have the piriformis. Remember that it runs and connects to the front of the sacrum, and then connects onto the greater trochanter here. This guy is an external rotator, right? When it's tight, remember, it can push on the sciatic nerve and cause some sciatica symptoms. Movement mechanics. Woohoo! We're like almost halfway done. I'm trying to do it fast for y'all. It is review. See?
You just did all those muscles 2 hours ago.
See, you're good. So flexion and extension happens on the sagittal plane. You remember planes?
This is on there.
So sagittal plane, remember I am a Sagittarius with a bow and arrow and I'm shooting it straight across. So flexion extension happens at that plane, right? Abduction, adduction happens on the frontal plane. Then you have your rotation that happens on the transverse plane. And then you have something called an agonist and antagonist balance, which is key to posture. So you need your main muscles and its counterparts actively working together to keep posture and to keep symmetry. Always. All right, postural and functional relevance. So, quick little guide here. If you have tight hip flexors in the front, low back pain. If you have weak glutes, weak butt muscles, your hamstrings are probably overused. If your quads are short in the front, it's going to anteriorly tilt your pelvis. Stretch those bad boys. So remember, massage will help restore balance and function of these muscles that might be pulling on the hips. A lot more people need glute work than you think. Tiny little words. I'll zoom so you can see it better. Sciatic nerve impingement. First off, I'm going to show you a picture here. So a lot of times, sciatic nerve can be caused, oh God, from a bulging disc or a herniated disc. All right. So here's your sciatic nerve. We're going to show this here. So in this picture here, if something is pushing on that nerve, it's rubbing it, right? And you're going to have that pain running down your leg, typically. Here's a bulge from the a different view. Right, causes for sciatica or nerve impingement. Herniated disc, a bulging or ruptured disc that can happen in the low back that can press on the nerve. So that's a main cause. So we're talking L4, L5, sacral region. Bone spurs can happen on the spine. So bone spurs is extra bone growth. Typically our body does that because there's some dysfunction and it thinks it's protecting it, right? So the overgrowth can cause a narrowing of the spinal canal and thus pinch your nerve. So there's less room in here. And what happens then is they usually have to go in and do surgery, and it's called a laminectomy. They kind of clear some of that out to allow more space for the nerve. Spinal stenosis. All right, so this can be caused from arthritis or spinal injuries. It's a narrowing of the canal, right? Tumors. This rarely happens. It's more rare than the other, like the herniated disc and the spurs and stenosis. But tumors in the low back can also compress the nerve. So that's why, like, if it's a tumor and the doctor's like, it's fine unless it starts causing complications elsewhere. And then piriformis syndrome, that is typically just when that piriformis muscle is hypertonic and causing an impingement. So what is sciatic nerve impingement or sciatica? What are the symptoms? Pain that radiates from the lower back down one leg or both legs. It can affect both sides. Typically, it's just one-sided. Right? Often into the foot or heel, they can feel it. Because if you look at this picture, that sciatic nerve runs all the way down. It does branch off into other nerves, but ideally, it's going to go down to the foot. All right. They can have numbness, tingling, burning sensations traveling down the leg. Weakness in the leg muscles, especially anything being innervated by the sciatic nerve. This can cause difficulty walking or standing for long periods. Boom, baby. Now this part is a little bit of a review and a little bit not a review. A little bit of a nada. Pelvic tilt types. So the pelvis acts as the foundation for your spine and hips. Its position's controlled by balance, right? Between both anterior muscles and posterior muscles. The main thing involved in pelvic tilt are your hip flexors and extensors and any muscles that would stabilize your trunk. There are different types of tilts. You have neutral, which is normal, anterior, posterior, lateral tilt, and rotations. All bad. All common. So neutral would be your ideal alignment, all right? This is when your ASIS and your pubic symphysis are on a vertical plane. If you were to look at somebody's hips from the side. Now, you can't quite see this because, you know, we have all other tissues other than just our bones. But that's what we would consider neutral, all right? The muscles are balanced. Everything's working as a whole harmoniously. Right, the posture, you're going to have a neutral spine, optimal joint alignment. Your movements are going to be super efficient, right? So for massage, we're going to just maintain their neutral position. Just do your normal massage, work on what might hurt and what not. Right, we're not going to do any corrections with the hip. Anterior tilt, one of two. So anterior tilt, remember, is when the front of the pelvis drops down, all right? What is happening with this is you are going to get hyperlordosis of the spine. Common causes would be prolonged sitting, weak abdominals or weak core, weak glutes, tight hip flexors, tons of stuff going on. So if the tilt is musculoskeletal and we can kind of fix it, they might go through like a PT program and also strengthen what's weak. And then the combination of us and their PT or their exercise program might really help this tilt. So muscles that are overly tight might include hip flexors, right? Rectus femoris, TFL. So things in the front. And even your back extensors. So this is where your QL might be like, hey, I'm going to be super tight. Or your erectors along the spine are going to be super tight because it's trying to keep things balanced. What muscles might be weak? So these are the muscles that you would suggest maybe you guys should strengthen these muscles, right? I suggest it. Would be your abdominal muscles, your obliques, right? So any abdominal muscle from front to lateral. And then they're going to also want to strengthen any hip extensors. All right. So that would be things in the back like your glutes and your hamstrings. So they might want to do not skip leg day.
Don't worry, Cole doesn't.
Don't skip leg day. All right, the second part of this. What are the postural effects? Exaggerated lumbar lordosis. So they're going to have that forward tilted pelvis, which might make their abdomen protrude a little bit more. And it also might then affect the knees and make them hyperextended, right? So that's when you are standing like this, and you can't quite see because my jeans, but hyperextension would be like this, okay? The knee's not supposed to go back like that, all right? You're supposed to actually be nice and neutral, all right? So, no hyperextension, please. A lot of times this anterior tilt causes back pain, low back pain. So what we're going to do is focus on stretching the hip flexors and the erectors, all right? We might want to have them strengthen, or we can work on the glutes and abdominals if we want. I typically wouldn't do abdominals. I'd maybe do the hip flexors in the front. Combine the pelvic stabilization with mobility techniques. So you can also do a lot of active release or muscle energy stuff with this. Now we're going to talk about the opposite tilt. You had anterior. Now we're going to have posterior. Pop and lock. So posterior is the front of the pelvis lifts upward and the back drops down, so it's kind of tucking your tailbone in, okay? So that's what's happening there. It decreases or flattens the lumbar curve, so you're going to have that flat back, right? It can be caused from posture, prolonged slouching, overuse of the hammies, or weak hip flexors. The muscles that might be overly tight would be hip extensors, so everything in the back, your abdominals. So typically what's happening, I know this is really confusing, but this is just the theory. We're talking about the hip. We're talking about it tucking. All right, so they're saying you're going to have weak hamstrings. Right. Typically what's the opposite of where that joint is also going to be the weak. So weak is usually what happens. Tight is usually what happens. Just think of it as an X on the body part, and above the joint is kind of mimicking, but the opposite of what's going on below. So I know it's really confusing, but that's kind of what's going on. Hypotonic would be, I got that wrong, it was hyper. So hypotonic is opposite. So hip flexors would be overly stretched and weak, maybe. Psoas is thrown in there, the iliopsoas and the rectus femoris. And then you're going to have weakness in your erectors or your multifidus, all those tiny little muscles that run along your spine. Posterior tilt 2 of 2. Postural effects: flattened lumbar curve, tucked under pelvis. You're going to have a rounded lower back, sometimes short-stepped gait, they call it. You might have limitation when trying to do a hip extension or stiffness when walking. Doesn't seem fun anyhow. Massage focus, we want to kind of stretch out the glutes, the hammies, the rectus abdominis. We want to activate or have them strengthen their hip flexors and erectors. A lot of times you can combine postural retraining and movement drills. So if they're having this because of postural and slouching, they need to fix that, because you can work and try to fix it. Then as soon as they go back to their behaviors that they were doing before, or their repetitive movements or lack thereof, you're going to have the same muscles being affected. So your client has to really work alongside you to fix a tilt in the pelvis. Then we have a lateral tilt. A lot of PTs call this an upslip. This is when one side of the pelvis is higher than the other. Remember we talk about this? Higher than the other, right? Where am I at? This is often due to either a leg length discrepancy, so you can actually have an anatomical leg length issue where one leg really is longer than the other or shorter than the other. Scoliosis could cause this because remember that the spine directly affects the hips and so on, and vice versa. Or you can have unilateral muscle tightness. So the tight muscles would be QL on the affected side. That is why I taught you guys to dig your elbow into the QL, right? And then any of your adductors on the lowered side. So the side that's lower, you're going to hit those adductors, right? Weakness, gluteus medius on the dropped side, right? So when we are dealing with an upslip or a lateral tilt, massage focus is mainly releasing that QL and the adductors that are on that affected side. So when we're doing hip stuff, really, really try to get them to do their legs. A lot of people don't want their legs massaged, but when we're trying to balance the hips, it is very important to include that. And then maybe you would have them try to strengthen their gluteus medius, all right, on the lower side to prevent the pelvis from trying to pull back and level itself. Now here's a rotation. So what I'm talking about here is I'm not just talking about this going up. I'm talking about it actually rotating forward. It can rotate backwards, one-sided. So it's not the whole pelvis. We're talking about one-sided. So you can have one side that's got a rotation anteriorly and one that's going like this. Right? That would be a really severe case. And then typically, and I can't remember which side it is. Typically you're going to have, if there is an upslip, you're going to have a rotation on this other side a lot of times to kind of balance it out. Stay, sir. All right. So this is common in athletes that have a dominant side, primarily. Somebody who overdoes it and has a main primary side, dominant side when doing movements. So what happens when there's an imbalance, it creates kind of a torque, so the twisting, right? And this can affect the lumbar spine and the SI joint. So they're going to have a lot of discomfort right at the sacrum in the back. Maybe they'll have it in the front, the hip flexors, right? So here's an example here. Say their right side is rotated, all right? Right side moves anteriorly. Your left side moves posteriorly. So we're doing this, all right? Posterior, left, yes. Right? So what's happening with this is it results in that right side here appearing longer and the left side shorter. So if you're not noticing that you have an upslip and the one side looks shorter, there's a good possibility that you have a rotation. So the best way to figure that out is to try to find the PSIS in the back or the ASIS in the front and kind of see where they feel. And you can kind of feel if one's like this. It's going to be in different spots, all right? All right. Good stuff. Whee! 2 of 3.
I love how we're all chill and she's like trying her damnedest.
Yes, wakey, eggs and bakey. I had too much sugar. Hypertonic muscles. So what's tight? On the forward rotation side, you're going to have, I'm going to lift this guy up, forward rotation, psoas, rectus femoris, TFL, all this is real mad, right? On the posterior side, you're going to have glute max, hamstrings, piriformis, erectors. So just think if this is going this way, everything in the front is going to be smacking like this, all right? If this is coming backwards, Everything here is going to be compressed. The opposite will be weak. Weak side. On that right side that we're talking about is forward. Your glutes and your abdominals are going to be real weak, all right? Real weak core. On the posterior side, your hip flexors and your contralateral, so your obliques are going to also be weak. We're almost there. We got this, guys. 3 slides. Then you can go to lunch, and I'll do some hands-on next week to give you a break. Whiners. Rotation. 3 of 3. No, I mean, y'all are still hands-oning, but I'm not going to show you stuff. I'll do all the glute stuff next week if you want. Although that's the fun one. That's the fun stuff. We'll discuss. All right. Functional effects of a rotated pelvis. You're going to have uneven gait or stride length because your legs are going to appear to be different lengths even though they're not. Your SI joint is going to be uncomfortable. You're going to have low back pain typically. Then you're going to have asymmetrical hip rotation or knee tracking. So it's going to ideally affect your knees too because you're not hitting the same if one leg is appearing to be higher, right? What we're going to focus on is trying to get those hip flexors kind of released a little bit, all right, so that that forward side kind of pulls back a little. And then the opposite side, we're going to try to do the hamstrings and the glutes so that it rotates back a little more symmetrical. Have them strengthen any weak muscles, all right, so to try to help their balance, right? That would be obliques, glutes, core. Tell them to do core, right? And incorporating that muscle energy technique where they are contracting with you is going to really show some awesome positive results because you might not be able to get into those deep muscles. It might be painful. So if you utilize muscle energy techniques, it might help realign them a little quicker, right, and with less pain. All right, massage and movement integration. When dealing with issues, you can do deep tissue for the glutes and the hamstrings. You can do cross-fiber friction at the attachment points, right, as long as it's in an area where you can access. Active release on the piriformis, which when we do glutes next week, I'll show you some piriformis stuff. Assisted stretching, so you can help them stretch their quads, flexors, hamstrings, all that. Red flags. So here's a hamstring tear. We have grade 1, all right? Only some of the fibers are torn. Grade 2, all right? You have a more severe partial muscle tear, and then we have a complete rupture, all right? Do not work on somebody who has an acute strain. Wait for it to be healed enough so that you can properly work on it. And then it's super weird. Sometimes you can feel the scar tissue from where the muscles decided they wanted to grow back. Or they sometimes need it surgically repaired. If they've had a recent hip replacement and a knee replacement, make sure they are cleared by their doctor to get their massage. A lot of times they're going to have these hip issues after that, those replacements or surgeries, because they've changed the way they walked, like instantly. All right, so just think of that. If they're having sciatic nerve irritation, this is more of a caution than a red flag because we can work on some sciatica issues anyhow. And then, again, look for bruising or inflammation. All right. You did it!